So a little push here. So push here. Can I have you pop up onto your hands again, how we did in the beginning? Bring them all the way up to here, because that's where we felt that pinch. Is that pinch still there?
It's much better.
Still there a little bit though?
Yeah.
Okay, can you go face down one more time? Right on our multifidus muscle into the lumbar spine. And so that little electrical current is going to help give us a nice little reset. So let's go ahead and recheck that. And go ahead and pop one up.
Oh, wow.
Yeah?
That's really cool.
Is that pinch gone?
Yeah, it's gone. Like 2015, 2016, and I think like when I stand up and stuff, you'll be able to see what they saw. I had a lot of like lower back pain, and they told me that it was attributed to the hips and stuff.
Okay.
And I mean, no reason really that I haven't come, just kind of like money and time and whatever.
Okay, gotcha.
Yeah, but I know that like the way that my knees are and the way everything aligns, like I should honestly be
Okay.
Yeah.
So when you were seeing the other chiropractors, did you find that to be helpful for
Yes.
those issues? And is
Totally.
there pain related to the hips and low back? Or you just feel
at
like
times,
something
and I
is
just
off?
sit a lot, so like that's
Okay.
where that comes from, I think too.
So with work and ergonomics now, are things a little bit different?
You know, I'm not like experiencing pain. It's like when I work out, I notice a lot of tightness in the hips. When I stretch, there's a lot of like popping that goes on.
Okay.
That's, yeah, the hip issue.
Okay, so it's primarily bothering you when you work out?
Yeah.
Okay, any specific movements, squats, deadlifts?
Yeah, like if I like do this.
All right.
Like that.
You got them done. Okay.
Yeah.
And when you do that, is that painful?
No.
It's just something that
It
you
feels
notice.
good.
Okay.
Yeah. Yeah.
Okay. So that's not necessarily the thing that's bothersome. It feels a little bit deeper than that.
Yeah.
Okay. Cool. Well, let's go ahead and we'll check them out. Is there anything while we're in here? We'll just kind of run through everything.
Yeah.
I would assume it's been a while since you've been adjusted.
Yeah.
You said 2016?
Yeah.
Okay.
15
Cool.
or 16.
And were you getting pretty consistent care when you were seeing those guys?
So it was a period of time that I went pretty consistently, just because I was having that lower back issue and like needed to get it resolved.
Okay.
But after that, I haven't been back.
Okay. And the low back issue, was that diagnosed with
No.
anything? Okay.
I mean, maybe, but I don't recall.
And you're not really experiencing that
No.
stuff now? Okay, cool. Nothing shooting down the legs, no numbness, tingling, weakness?
Mm-mm.
Cool, no pain with coughing, sneezing, using the restroom?
No.
Awesome. Well, while you're sitting right here, I'm going to have you just kick out one leg straight. And then if you can pull the toes back towards you. Any issues behind the knee or in the low back?
My knees are always tight, but I think it's just because like I have double jointed knees.
Okay, gotcha. So you have
yeah.
some flexibility there. If you hold that there, bring your chin down to your chest and a big slouch here. That all feels pretty good.
Mm-hmm.
Cool. Let's do the same thing on the other side. And big slouch. That feels pretty good.
Mm-hmm.
Awesome. Let's go ahead and stand on up. Let's bring the feet together, and we're going to take the right hand, slide it down the pant leg. Any pain, pinching, tightness with that in the hips?
A little in the front here.
And that was kind of what you did to create that pop in the first place. So when
Yeah.
you do that pop, does that feel like that's what releases it?
Yeah, I
And you
think
get
so.
more range?
Yeah.
Okay, so you're feeling it this side. Let's go ahead and flip to the other side.
Less there.
Less there. Okay.
Yeah.
What if we rotate all the way towards one side, and then from there, can you bend backwards? Perfect. No issues with that?
Mm-mm.
Same thing to the other side. That feels pretty good.
Yeah, I just feel like I'm less flexible doing it this way.
Going to the left.
Mhm.
Okay. Let's go ahead and slowly run down, touch the toes. I'm gonna lay down the back as you do that. And can you slowly come on up? Good. Awesome. That all looks pretty good. No issues on the way up. Take the hands here. Poke the belly out. Feels pretty good.
Mm-hmm.
Let's go onto your back. So you've never had anybody specifically look at hips?
I don't think so, no.
Okay. Let's go there. Cool. And it's not really one versus the other. It just kind of, they both feel off.
Yeah.
Okay.
I think the right is slightly more, but
Okay. So I'm gonna just take it through some ranges of motion as I kind of come in through here. Any pain, pinching, tightness?
A little tight, but nothing.
Is it more tight when we're in through there? And it feels more open as we go out here?
Mm-hmm.
Okay, so if I take your leg into internal rotation, any recreation of that tightness?
Mm-mm.
So you have really great motion here. We've got that 45 degrees, which is what we're looking for. And we've got that 90 degrees here. Any issues with that?
It was tight.
Just tight?
Mm-hmm.
Like, felt like a stretch?
Yeah.
Okay. And then pushing down right here.
That's fine.
Okay, just feels like a stretch.
Mm-hmm.
Alright, so same thing on this side. Oh, that feels pretty good.
Mm-hmm.
Even more mobility on this side. You notice that?
More mobility?
So we were at 45 degrees on this side. We're even further out here, which is good. Do you have any issues with hyper flexibility ever?
What do you mean issues?
Like just feeling instability, or like, have you had like more injuries in the past than?
No, I mean, I'm always like conscious of it when I'm working out and stuff, like instead of, and I know you should always keep a bend in the knee anyways, but I kind of just make sure that I am yoga poses and stuff like that.
Okay, cool. So a lot of the stuff we may end up doing is going to be more stability type PT exercise stuff that you're going to be doing on your own at home in order to address these, because mobility wise everything looks really great. We just noticed that little pinch on the left side, no pinches on the right side, and even crazier mobility on that right leg. Let's go ahead and flip onto your stomach. I'm going to check out a few more things. And just checking kind of leg length. So do you notice the side, a lot more tension to get to that same point?
If you're holding them at the same point right now, yeah.
Yeah, so naturally they kind of sit like that. That would be evening it out.
Mm-hmm.
That's just looking at quad tension that can dictate some of that rotation in the hips that you're noticing. So pressing in through here, no pain with that?
No.
Okay. And all that stuff feels pretty normal.
Mm-hmm.
Do you have more tension here, like more tenderness versus this side, or is that about the same?
I would say it's about the same.
Okay, but pretty tender?
Fairly tender, yeah.
Okay. All right. Upper back, mid back, all that stuff feels pretty good?
Mm-hmm.
Okay. Go ahead and take both hands right here, and go ahead and push your upper body up, leave this on the ground. Any issues with that?
Mm-mm.
Can you extend the arms completely? That feels pretty good?
Yeah.
What if you take the hands up to here, same thing?
Lower back right.
Lower back right?
Mm-hmm.
Okay. And is that similar to that feel when you kind of bent over to one side?
No. Oh, this is in my back.
Okay.
My
Versus
actual back.
those.
Yeah.
Okay, gotcha. You can relax, and if you want to take a seat. So that last little check, kind of the two things together, when you were face down, when I brought the heels back, we noticed there's a little bit more quad tension on the right. And then when we did the press up, you noticed back right kind of into that same place. So that is going to be more your sacroiliac joint. Are you familiar with that? I will pull it out. So we have our sacrum here, and then we have the ilium both sides here. So we call it the sacroiliac joint. It sits kind of right in between there. So that can dictate a lot of our hip rotation. So there wasn't too much musculature that was really off. I think it's sheerly just a joint thing. So let's do an adjustment, and then we'll recheck those tests that we just did and see if we're able to even that stuff out. I am going to do a little bit of work into the glute and into kind of our erectors, this little junction right here, and see if that helps to even it out, if there's a muscular component with it. And then I'm going to do some hip activation stuff with you so that we can start to create some stability in the low back, because if all we did was adjust you, it might feel good for a little bit of time, but if we're not doing anything to change that pattern, it's not really going to be a permanent effect. So I'm going to run through some hip exercises that will actually kind of help you build on mobility versus just being really flexible. So all I did was check flexibility. I kind of differentiate the two in that mobility is the flexibility that you can control and use. So for your workouts, running, sitting, standing, just everything in between. That's what actually is true mobility or true flexibility is what I think of it as. Does that kind of make sense? So definitely kind of work out that complex, and you would probably notice it with your workouts, right? So that would be, are you working out today?
I haven't yet.
Are you going to?
Should I?
I think it'd be a great thing to do, because then
Okay.
you can kind of test and see if what I did in here was helpful, and then it just reinforces everything that we did in here. So I always kind of go for that if you can.
Yeah.
There you go. It might not have been recording. We'll see. Okay, so the first thing that we're going to look at is this. So you may not feel it. This is what it would be to even it out. So I'm going to start with just some traction and then releases, and then we're going to recheck that. So the table's going to come down like this. Are you doing okay with that pressure there? I like to start with this just to make our adjustments go a little bit easier. It also just feels really good, especially if you've been sitting all day.
Yeah.
So you are working from home now?
Yep.
Okay. But you said that hasn't really changed with ergodynamics, just kind of...
It's probably worse because prior, like, you know, the company invested in really nice chairs for the office, and now I have some chair that a friend gave me, you know.
Okay, gotcha. Are they helping you guys out with any of that stuff?
No, definitely not.
Okay. Real quick, are you doing okay with this pressure?
Yeah.
Is that significant?
No, I mean, it feels good.
Okay. Let's go ahead and take a few big breaths through there. And you said you do get massage?
Yeah.
Okay. And they were the ones that kind of told you might be a chiropractic thing?
Yeah.
Gotcha. How consistent are you with that?
Like once a month.
That's so good. That's really hard to do, being consistent with kind of like body care, but... Alright, so I'm going to keep doing rechecks on that just to kind of dial in on what muscle that might be. So rechecking here, still a little bit more, but a little bit better. So I'm going to come into glute medius and piriformis. Can I press into here? Okay, so going to find that attachment site onto the hip right there. And coming in with my elbow, I'm going to take the leg out in this direction. Are you doing okay with my pressure?
Yep.
Okay. Last little recheck. Sweet. Do you notice that?
Yeah, I do.
So that was pretty fast. That was just muscle work, and I can actually show you how to release all of that stuff on your own at home, because that likely isn't going to be a permanent thing. So let's get into our adjustments. I'm going to have you go ahead and face me on this side here. That was me. I was moving the chair. So we're going to kick the bottom leg out straight. Scooch this one. Rotate here. Let's bring that elbow up. Good. Are you comfortable in this position? So a little push here. Good. That was easy.
Yeah.
Felt pretty good?
Yeah.
Let's go ahead and face that way. Those were some quiet ones too. I guess I haven't adjusted you before, right?
I know, I was just thinking that, saying that it's been years. Well, it probably still has been years since you adjusted me, but yeah, you
That was
have.
like floor adjustments in the living room, right? Alright, let me scoot you this way. Yeah, only so much you can do, really, on the floor there. Cool. So this is kind of our SI joint. The last adjustment was directed more into lumbars. So push here. Good. That felt okay. So I'm gonna have you sit up. I want you to keep your, actually scoot forward about 3 inches. Perfect. gonna have you bring your hands like that. Bring it around the head. And we're gonna take that in. So big slouch, big tuck. Good. We're just gonna roll back here. I gotcha. All right, and then I'm gonna take the arms here. Can you bring your chin to your chest?
Mm-hmm.
Big breath in, let that all the way out. Okay,
Mm-hmm.
there's a lot of pressure. Yeah, every time it feels the same as when I first got adjusted.
That's cool.
All right. And you said there's no real issues through here, no headaches or anything like that?
Mm-mm.
Okay. I'm just gonna kind of feel around in here and see if I find any spots for us. No tenderness through there.
Mm-mm.
Perfect. Let's just get some movement going in there. Good. It's a little push here. Awesome. Holding back the laughter now that you're thinking about it. Cool. So we'll just fall back into this hand here. And I'll move you around there. Great. All right. You're not a noob. No laughter. So I'm going to run through all the other joints and then we're going to recheck your hips, make sure that is feeling pretty good for you.
Cool.
Oh, you are double jointed.
Mm-hmm.
We're not going to be adjusting that. Cool. Does that ever bother you?
Sometimes I do experience yeah, sometimes.
Okay. Sorry. These are not always the most comfortable things in the world. You okay there?
Mm-hmm.
What's your background with sports and stuff?
I was a dancer and a cheerleader.
Okay. So all the big joint sports.
Mm-hmm.
That's good. I'm really curious how the volume sounded with the multiply by 25. We will see. Cool. A little push. A little pull here.
I feel it. I'm just not giving you much content for your popping.
There we go.
Yeah.
You do have quiet pops. Cool. Let's go ahead and sit up. So no real issues with the neck. I'm gonna have you swing the legs around. We'll get the shoulders, and then we will recheck the hips. If you look left and right, up and down, does that feel a little bit more open to you?
This side is nice and open, and this is tight in through here.
When you look to the right, it feels tight here?
Mhm.
Okay, cool. I'm gonna do shoulder adjustments and then a little bit of soft tissue. That tightness here,
Mm-hmm.
is that kind of where you're noticing it?
I was noticing it more in the neck, but
In the neck.
what you're feeling too is tight.
Okay. So we're gonna do a little pull up here. Doing okay with those?
Mm-hmm.
Where you were noticing it up through here?
Lower actually.
Could you kind of point to where?
Yeah, like here.
Okay. Is that tender when I
Mhm.
press in there?
It feels good, yeah.
Let's actually do a little bit of scraping over here. Have you had scraping done?
Mm-mm.
Okay. Are you familiar with it?
Just from like videos and stuff, yeah.
Cool. So nothing too crazy. I like to use it as kind of a generalized reset in the muscles. Let's take that over here.
Oh yeah. I should have asked do you want me to put it up?
That's okay. We're
Okay.
just gonna run through this spot real quick. Are you doing okay with that pressure?
Mm-hmm.
Okay. So we can get specific with it. I think that there's not necessarily a specific muscle there, so we're just going to hit all of it. No issues. Okay. So recheck that same motion. We just did super fast soft tissue, looking over to the right.
Oh yeah, that's cool.
Isn't it?
That's really cool.
So I'm going to show you some movements to make sure that that holds on, because that is kind of like a little body magic trick. It's not like I actually change anything in your physiology. We just kind of trick the nervous system. So our quad tension, yes, we still have a little bit more right here. I'm going to do a few drops onto the hip. So the table is going to pop up and make a really loud sound right into kind of the belly area. You okay?
Yeah.
Okay. That's my best warning.
Just shocking.
Right. And then I'm going to do a little push down like that. Really gentle, just sounds crazy. So popping up again and push here. Doing okay with that? 2 more. Cool. So we still have a little bit of that tightness here. I think we can fix some of that with the exercise I'm going to show you. Can I have you pop up onto your hands again, like we did in the beginning? Bring them all the way up to here, because that's where we felt that pinch. Is that pinch still there?
It's much better.
Still there a little bit though?
Yeah.
Okay, can you go face down one more time? And still kind of in that bottom right.
Yep.
All right. How do you feel about needling?
I'd be down.
Needling for me is like the biggest thing that has ever helped me for my low back,
Really?
even with like chiropractic care. I'll give you a little spiel on it. Have you ever had acupuncture or anything like that?
No.
Okay.
But I mean, I've heard, for those who like need it, or whatever, sought it out, like it's really done wonders.
Kind of like right into here.
Mm-hmm.
Nothing up through here.
Let me do it again quick. Yeah, kind of in this area.
Let's see. Okay, so I'm going to put one into glute medius and then one into the lumbar spine. Do you mind if I lift your shirt up to here?
Yeah, my pants are there too.
Okay. And then I'm just going to put a towel in.
Okay.
So just going to slide this down to here. Cool, so we're going to get glute medius through here, and then we're going to connect a little wire in right there.
Cool.
I mean, you're just thinking out loud.
How would you describe the needle sensation?
So we're looking at 2 things. One is going to be, hang on, let me get it. Looking for 75. Cool. So 2 things, 2 sensations you might feel. Sharpness. If it feels sharp, it shouldn't, so let me know.
Okay.
The other thing is achiness. So it's going to feel kind of like a deep ache, and that's actually what we're looking for. That's kind of the activation portion of it.
Okay.
Once it's there, it kind of dissipates. You won't feel anything, and then we're going to hook up some stim to it. So I'm going to start just kind of onto our L5. So we've got this right here, but it'll just feel like a little poke. I'm going to slide this down a little bit further. All right, so just a little alcohol. Cool. So we're going to do a little poke right at L5. So that's just the outside of the needle. I'm going to do a little push. Cool.
Yeah, I don't feel, like the sharpness at all.
Good. Yeah, so that's what that feels like. Nothing too crazy, right?
Mm-hmm.
And then this one is going to go into kind of our glute medius, so right behind the iliac crest, kind of where we feel our hips. This top portion right here. So I'm going to slide this down just a little bit. And feeling into hip. All right. So same thing, little poke. Might feel a little twitch. That feels okay there?
Yeah, that one I feel more of the like.
That achy.
Mm-hmm.
Cool. So we're gonna put some electrical stim through there and give a nice little reset to it. So have you ever had TENS? Like the little electrical pads?
I don't think so.
It kind of feels like a deep little massage.
Okay.
So I'm gonna just start it very gentle. You just let me know when you start to feel anything, okay?
Anything at all?
Yeah.
Ooh, yep.
Okay, is that too much?
Yeah, that's good.
That's better right there?
Yeah.
Okay, perfect. You feel that little heartbeat there?
Yep.
Nothing too crazy?
No.
Okay. So I'm going to see if we can kind of reset these muscles. So we've got our glute medius is this one kind of out to the right. And then we've got right on our multifidus muscle into the lumbar spine. And so that little electrical current is going to help give us a nice little reset. So that's that SI joint that we were talking about. Our glute medius is one of those muscles that can affect that area. So I'm going to hang here for about 30 more seconds. Can I turn it up just a little bit more?
Mm-hmm.
Is that manageable?
Yep.
Cool. Perfect. Just keep taking those big breaths. Kind of a funny treatment.
Yeah. I mean, it totally is like a heartbeat.
Yeah. So we can change that frequency, but with some people, when we have a really big dysfunction, that heartbeat is actually really far off. And as we kind of hang here for a minute, that electrical current actually stabilizes and we get more of a regular heartbeat, if that's what we want to call it. So, cool. All done with that. Let's pull our needles out. Doing okay with that?
Yeah. Pretty cool.
Alright. So let's go ahead and recheck that. And go ahead and pop them up.
Oh, wow.
Yeah?
That's really cool.
Is that pinch gone?
Yeah, it's gone.
What?
That's really cool.
Yeah.
Very cool.
So we kind of hit a lot of stuff in this session.
Yeah. You want me to sit up?
Yeah, that's cool. So I'm going to shut the camera off and we can get into our exercise stuff.
Cool.
Good stuff?
Thank you.
That's fun.
Yeah, that's
So
really
if you just went home and sat there, you might be sore for like a day or two. But that's why I like to integrate things, because what I do in here is we open up ranges of motion, we take away pinches, we take away those pains, we equalize things out. But if you don't do anything different or you don't integrate or move or change those things, it's not permanent. It just feels good for a little bit. And those are the patients that get to see me once a week for the rest of my life, which I don't mind, but obviously we'd rather get you better and stay better. Thanks for watching if you stayed to the end. If you liked the video, do me a huge favor and smash the like button below. And if you're not currently subscribed and you want to see more content like this, go ahead and hit my face button right here so that you don't miss out. I post about 2 videos per week.